Kim, great to have you on Startup Health TV. Take your mic. We got to talk not long ago for Startup Health magazine. You gave me a sense of what you're working on, but now we can share it with the world, okay? So
beautiful.
Tell me about Play It Health. What are you creating?
So we've created a platform that tracks, scores, and incentivizes adherence to prescribed regimens in a way that hasn't been done before.
Okay.
And so we bring all the critical elements together, all in one little package, and bundle it into a score that makes it understandable by everybody across the ecosystem. Okay. And then we couple all that with a rewards platform that literally makes people engage and makes it more enjoyable for them to engage.
Okay. Who is a target patient?
Yeah, so part of our biggest vision is that we want to be part of what I see as a new march in chronic care, where we're taking patients through chronic conditions and beyond.
Okay.
And so, as you know, part of our history as a healthcare system is that when people get sick, we consider them sick, and we don't look at them as ever getting well again.
Yeah.
Well, I very much believe, for a variety of different reasons, that there's a lot of productivity that people have in them after they've gotten chronic conditions, and we really want to be part of that march moving through that. Our solution can reach across the diversity of illness and wellness. In other words, it's much easier for us as a platform that can reach those with chronic conditions to also reach back into wellness than it is for wellness platforms to reach those with chronic conditions.
Got it. I feel like you're speaking from personal experience. You're alluding to the idea that you experienced that productivity when you were maybe being labeled as unwell.
Yeah, no, you're right. I mean, it's not a secret at this point in time. I've been part of the process of bringing these issues to light. So I am a 3 cancer survivor, and it's one of those things that definitely in the entrepreneurial world oftentimes you don't speak about. Okay. But I have very much believe that as communities, if we discount people once they've gotten their illnesses, we're going to lose a whole segment of productivity that we shouldn't lose. There's experience there's life experience, and there's even just all that learning that happened before then. Medicine is so advanced now that we can offer people near normal life expectancies even after going through multiple cancers. Got
it. Okay, so there's this sort of care pathway that you're assisting with. Talk me through sort of the secret sauce of the adherence side. You know, how do you uniquely help someone stay on the path to healing?
So a lot of it's TLC basically combined with tech. Okay. And so we believe in the power of tech, but we also still believe in the power of good old clinical care and that ability to reach out to people. And so our platform is designed to be a tool for clinicians and other members to reach patients rather than a substitute for that. Okay. And so we worked very hard, almost with an artistic sort of approach, with the messaging, with the, for lack of a better word, the Attaboys, the Attagirls, the way that we bring the point systems in.
Give me an example.
Yeah, so...
You've been artistic about it, tell me.
Well, I mean, I think the artistic sort of parts about it are learning how even to just tailor the education so it really hits somebody where they want to be at a given point in time. So, for instance, there are days when, yes, patients are very much open to being educated about what they need to do. Yeah. And so we have imagery that does that kind of thing. Okay. And then there are days when people really just don't want to feel that they're being educated. Yeah. And they might want to just see imagery that's more inspirational, sort of takes them away from their illness. And so the overall sort of vision of our platform isn't that we're creating people that are entirely looking at a digital platform every day. Yeah. We just want this to be a tool that they can intermittently engage with and move on with the rest of their lives. Got it. So it's really something to kind of free them up from their chronic conditions rather than make them think about it every single minute of their lives.
Yeah, not define them.
Yeah, it's not going to define them. We're hoping that this platform helps free them from those conditions.
Got it. Okay. Yeah. What are you excited about coming into the next year? What is 2020 going to look like for Play It Health?
Yeah, 2020 is going to be a big year for us, and a lot of that, in all honesty, has been gifted by the ecosystem. And so there have been billing codes that have changed that have literally provided reimbursement for exactly what we do.
Awesome.
But
Recently? Has it happened recently?
It's happened over the last 2 years, but
Okay.
what has happened recently is that adoption has started to kick in.
Got it.
And so oftentimes in healthcare, things are delayed and adoption is delayed, but literally in the last 3 to 5 months, we've seen that uptick in the interest and the billing, and I think it's gonna revolutionize the industry. I mean, we're very happy to be a part of that, but I think the ability to get reimbursed for remote patient monitoring, so we're gonna have data on people at home that we never had before. I really believe that's going to change clinical algorithms entirely.
Awesome.
Because we've developed all these algorithms not really knowing what people were doing in their homes.
Yeah. Well, Kim, I'm inspired by the work that you're doing, and we're going to be watching Play It Health in the coming year. And thanks for coming down to the StartUp Health studio and
Logan,
joining me.
thank you for doing what you're doing.
All right, thank you.
All right, take
All right,
care.
have a great afternoon.